Now let's welcome Kerry Lamb, Neuroscience Administrator for the Novant Health New Hanover Regional Medical Center. Kerry, thank you so much for taking time out of your busy day. I know how busy you guys are.
Thank you for having me.
And I'm really, really excited to learn about this facility. First of all, I have to tell you, it's absolutely beautiful. And if you had even one little piece of it to be responsible for, you did a great job.
Well, thank you. It's certainly been a team effort.
It's gorgeous. You've been involved in the planning for quite a few years, is that correct?
That is correct. It's been a journey.
Yeah, Laurie told us about how it started and then progressed into this. So, tell me a little bit about your background and what your role is here at Novant Health New Hanover Regional Medical Center.
Sure. Well, my journey with Novant Health New Hanover Regional Medical Center starts nearly 20 years ago.
Good.
I started here as a respiratory therapist.
Really?
And pretty soon after I started, I decided that I was going to follow a leadership route. Mm-hmm. So somewhere along my journey, I was the director for respiratory care and neurodiagnostics. And that tie to neurodiagnostics was my first link to neurosciences. And sort of as my career went on, this neuro part of the work started to grow. We started adding more and more programs and adding additional providers and services. And a few years ago, it became pretty clear that we needed to really establish neurosciences as a service line and have an identity for it and a leader for that service line. So I was fortunate enough to be given the option and the opportunity to lead this team and the service line, and so that's my role today. I get to be a part of an amazing team and oversight of all the programs and services that we offer here.
Well, it is truly a gorgeous place, but I know that Laurie and I talked about how we've added so many physicians to staff this Neurosciences Institute facility. So it's a big job now. You've really taken on a big job here. So let's start with an overview of the facility. So how many inpatient rooms do you have here?
We have 106 inpatient rooms and over 100,000 square feet of physical space. So it is an absolute beautiful facility, and all of those 106 beds are dedicated to patients with neuro-type disease and illness.
All of them. Mm-hmm. Well, how many floors does it occupy?
The Neuro Institute is a 5-story building, and we have services that include neurocritical care, neuro step-down unit, which is sort of an intermediate level of care, and a dedicated stroke unit. And we also have a floor that's dedicated to caring for patients recovering from brain surgery or spinal surgery, and another floor that's dedicated to caring for patients with all sorts of neurological diseases and illnesses like Parkinson's, epilepsy, multiple sclerosis. So yeah, we've got a lot of options for patients here.
How do you see this facility and this new institute benefiting patients? What do you see the patients getting from this?
Well, there's a lot of ways that patients will benefit. First, right down to the neuro operating rooms. If a patient needs to come in for surgery, we have some of the most state-of-the-art facilities and equipment that's really going to enable for some precision and enhanced imaging within those suites. And then when they get to the floor, whether they need neurocritical care or step-down level of care or just general care, all of that can take place on one floor. So streamlining the patient's experience with offering all of the services on one area. And of course, our Neuro Institute is staffed by a lot of specialists. We have a dedicated team of neurohospitalists, neurointensivists, neurosurgeons, and specially trained nurses and support staff. So the patients are going to benefit from just that streamlined patient experience and dedicated team of clinicians.
And they'll no longer have to travel.
That's right. It's an amazing thing for our community and region that we're able to offer all the services within neurosciences that they need right here.
Yeah, right here in their hometown.
Yeah.
And then their families here. That makes so much difference when you're surrounded by people who really care about you, your family, and as well as the nurses. And I think that's the biggest thing for me. I had a child who had neurosurgery when he was in high school, and it was in Cleveland, Ohio, because he was at the Cleveland Clinic, and so we had to travel hours and hours and hours to get there. And I lived at Ronald McDonald House for a long time during that, and that I see as a huge benefit for our citizens of New Hanover County, Brunswick County, Horry County, Columbus County. So I think that's a great thing.
Oh, yeah.
So I know you worked on this facility for a very long time, but now that it's open, are you satisfied? Are you still anxious? Are you still working out the kinks?
No, none of those things. I'm satisfied for sure, more than satisfied. I'd say the biggest feelings are gratitude and just excitement. I mean, it's definitely been a team effort to get to this place. It's taken a lot of focus and planning and working together, and so just grateful to be a part of it.
I'm curious what the doctors are saying, the surgeons, the neurosurgeons, and all the folks who work here. Are they happy about it?
They're so happy. It's palpable. You know, we've done tours through the space during different phases of the construction, and seeing the physicians and the team members excited about the space, and it's just it's very exciting getting to this place where now they get to work in it, and they get to be part of part of this wonderful thing that we've done, and then just excitement for the community and the patients who will be cared for here. The space itself is beautiful. It has a very healing environment.
It does. It feels so good.
Yes, light and spacious, and the patient rooms are the same way. They're just really light and bright and cheerful. So.
With all of the things that go on here at the facility, and then once the patient is discharged, how do you see this facility complementing our outpatient offerings? You know, all of our outpatient neurologists and what have you. Do you think that's going to be a benefit to them too?
Oh, absolutely. I mean, the whole continuum of care starts preventative care or diagnosis and treatment in the clinics, and then the hospital is here for that acute need, and then again the clinics are available for patients after they are discharged for that follow-up care, and again trying to prevent a repeat illness. And we're fortunate here in this community that we have the subspecialization for all the neuro providers, which I know Lori spoke about a little bit, but it is just nice that we've invested in that for the community. So
a lot of places this size of New Hanover County, they don't have all these wonderful facilities and these great physicians, and so we're really fortunate to have that here.
We are. We're very blessed in that aspect.
Well, thank you so much for being on my show today. I've really enjoyed getting to know you and to hear all about this beautiful facility. I hope you'll come back.
Well, thank you.
We can talk about some of the subspecialties. I'm really interested in the stroke and the ALS program and things like that. So I'd love for you to come back.
Well, perfect. Thank you so much for having me. It's been a pleasure.
You're quite welcome.
Thank you.